orthogonal cuts of the tibia that are perpendicular to the anatomic axis, since we're doing a bone transport. After the bone fragments are removed, a small incision is made at the site of a lengthening, and a 4.8 millimeter drill bit creates the holes for the osteotomy. This will then also allow for deposition of reamings during the preparation of the intramedullary canal for the tibial rod. The tibial rod for intramedullary nail is prepared as per routine. The nail is passed in the proximal segment and the osteotomy is completed using an osteotome. Once the osteotomy is completed, the nail is passed into its final position and is locked in a standard fashion. For small periarticular fragments, we recommend 3 interlocking bolts. The next part of the procedure is using a 2 millimeter drill bit to allow for the cables to be passed around the anterior cortex. It is important to ensure that the drill bits do not pass or cross each other, as it will make passing the cable not possible. The cable is passed through one of the tunnels around the top of the bone and then back out. The plastic component of a hemovac is used to cannulate with the cables, and then the metal trocars with the plastic and the cable are used to percutaneously bring or shuttle the cables outside the skin, exiting just distal to the docking site. The wounds are then closed in a standard fashion. A 2-ring circular fixator is then applied. Care is taken to avoid the path of the nail or its components. 2 pulleys are assembled to the distal ring. Distraction rods using a fluted rod and crimped with 2 nuts. The blue Alizarov clickers are used. These clickers at turn, a quarter turn, represent 0.25 millimeters of distraction. At the end of lengthening, the docking site is further compressed. The patient is brought back to the operating room where a custom interlocking bolt is used to capture the transported segment. This prevents any recoil or proximal displacement of the segment.